everybody, and good morning, and welcome to our Thursday live call, the midwife session. If you have any questions that you would like answered about your pregnancy, your birth, your newborn period, your sleep and settle, your baby and child first aid, then you are in the right place. So I will quickly, as you're coming in, say hello, let you know who I am. I am referred to by my family as the crazy baby lady, and I think that's probably starting to take off. I adore all things pregnancy and supporting women and their families on this journey. So my name is Edwina. I am a registered midwife. Thank you already for your time. And I jump in here a couple of times a week just to see if I can help or support you by answering some questions. I know through the hundreds and thousands of parents that I have worked with in this time, hey Jessie, that it can be a time where you're just really uncertain, and with uncertainty comes anxiety. And so I don't want you to be feeling anxious about this. I want you to be feeling excited and empowered, but also I want you to know what to expect, and that's the way that I teach. So we have online childbirth education classes, online baby and child first aid, and I'm super excited, which is cool that Jessica's just said that today we are launching our brand new product, which is online sleep school. So Birth Beats Sleep. And we've broken that up actually into 4 sections so that we're covering all ages of sleep, because it is very different, the advice and the support that I can give you, just to take you from a place of, again, and it's personally how I felt, particularly with Theo, feeling anxious about not knowing how long they're going to sleep for, what their sleep is going to be like that day. You know, are you going to be able to get dinner made? Is it going to be a 20-minute cat nap, or is it going to be a 2-hour sleep? Should you be going to sleep if you're really tired? So tonight we have a live masterclass on all things sleep. We are going to be also launching our Birth Beats Sleep program on the live masterclass. So you can find out a bit more about that tonight. So Jessica, I'm glad you're excited. I'm beyond excited. I hardly slept last night, and my husband was like, dude, you got a long day ahead of you. You need to maintain this. So please, can you say hello and let me know where you're watching from, maybe how old your baby is, or if you are currently pregnant. Let me know if you have any questions that you would like me to answer. That is what I love doing. I'm just fixing that up a little bit. I feel like I'm looking up at you. Maybe I need to put my chair up. That's better. Yes, and any questions that I can answer is something that might be an issue for you that we can help unpack. And often women will say that they watch these lives because you don't know what you don't know. So it can be that the questions that other women and other partners are asking, that then you're like, oh, I hadn't thought of that. And that is the beauty of our online program. When you join all our online programs, you also get access to our closed Facebook group, which is just full of an incredible bunch of mums who are so generous with sharing everything. I call it like the Birth Beat Mums group on steroids. It is just absolutely the most incredible group, and I get in there and answer your questions as well. Okie dokie. So Kelly will be watching tonight with her 7-day-old. Oh, wow. Yes, you will, Kelly. I imagine swaddled up, nuzzled into your chest is where your 7-day-old likes to be at the moment. Natalie Ryan said, I can't wait. I really need this. Hi, Edwina. What are the leaps? Hearing that it's not accurate. Look, Chanice, and again, I'll explain what the leaps are. There are definite developmental leaps that your baby goes through. You know, there's evidence and science to say that. What happens with the leaps, and I guess it's understanding what's happening in their brains that helps you to understand the leaps, is that your little baby's brain, so just as an interesting by the by, your little baby's brain will grow more in the first 12 weeks of life than it will in the first 2 years. So that's a pretty phenomenal fact. What happens with leaps, and leaps is just like a general term. I think it's a bit of a, like it's probably something that someone's come up with and marketed, but leaps essentially are developmental milestones. So as your baby's brain is developing, they hit these certain milestones. The milestones are then represented by something that, like an action or an activity that your baby's doing. So it might be that your baby's learning to roll or to push themselves up. You know how little babies learn to push themselves up, or smile or giggle. With that, when they learn to do new things, it's quite exhausting for them, and their brain is working at a whole new level. So you think about if you're starting a new job, or you know, you're in a new relationship, there's so much that you're learning at that time, even as an adult. It can be quite exhausting. Now, what happens with these leaps is when they're particularly big leaps, so particularly big developmental milestones, it can also impact the sleep. And that's often what's referred to as sleep regressions. The reason being is that so much activity is going on in the baby's brain. There's a few things that play into that, and we go into that in a lot more detail so that you can understand that in our sleep course. But for you, where I think people say that leaps aren't accurate, it might be around the timing of the leaps, because people talk about the 4-month leap, which leads to the 4-month sleep regression. That might happen at 3 months for your baby. It might happen at 5 months. Again, it's just getting to know your baby and knowing that every baby is different. All of that leap talk is just a general guide. So I think in terms of the leaps do happen, developmental milestones definitely do happen. They definitely can impact your baby's sleep. So it's good that you know how to manage that at the time. However, when people talk about them not being accurate, it might be more around the timing, and I will acknowledge that the timing can be very different for everybody's baby. Does that make sense to you? Is that a good way for me to be able to help explain that to everybody? I just find a lot of, when I've been studying and learning more and more about sleep and working with birth beat mums already around this space, it's so much easier if someone actually explains it so that you can go, oh, I get what's happening now, and I get what I need to be doing to not only support my baby, but improve sleep, not just for our whole family, but also for our baby. Give your baby the gift of sleep. So I hope that is helpful. Kelly has said she's forgotten what sleep was. Look, and Kelly, like, I'm kind of laughing along with you there, but there is a really serious note there that sleep is really needed for everybody. So I know that I'm not my best self when I'm not well slept. I feel quite anxious. I can feel really like everything annoys me. My partner annoys me. My kids annoy me. I feel like I'm short. I feel like I'm not my best self at work. All of these things happen. I feel like I don't eat well. I feel like I don't exercise. If I'm tired, this is how I feel. Now, I don't want you as new mums to constantly feel like you're just surviving. Does anyone else feel like that at the moment, that they're just surviving? I want to take you to a place where I can help you to be thriving and enjoying this period with your baby, as opposed to just feeling like you've got to get through each day to day, because that's not how we want to live our life. So, Kelly, I am laughing along with you there saying you've forgotten what sleep was, but that's not good enough. I want to be able to help you and to help your baby so that you can really be enjoying this stage. Lots of love there for that. I think I'm speaking to a lot of mums who feel like they're just surviving. Let's change that, mamas. Let's absolutely change that. Katie has said, hi Edwina, I have a 23-month-old and being induced with my second on Monday. Oh, how exciting, Katie. You're going to be a busy mama. Vanessa said, hello, I'm currently watching from Montreal, Canada, and 6 months pregnant. Hello and welcome, Vanessa. We have so many Canadian mums now, Canadian mums, American mums, New Zealand mums in our online birth courses, and it's so great to have you all there. Melbourne, Lucy said, my kids are all grown up, but remember very vividly the importance of having great advice around sleep. Thank you, Lucy. P.S. very excited to be coming. Lucy is local, and I just heard a rumor this morning that she's opening a coffee shop, so I will be hitting that up, Lucy. Jody, have an 8-month-old watching from Coolatai in New South Wales, waiting for the sleep masterclass. Gosh, my gosh, I cannot believe how many of you are just so needing this, and I'm so happy that we have put all the weeks and months and hours into the sleep course to be able to help you. Chantel, hi, I'm 34 weeks pregnant from South Australia. Baby seems to get hiccups a lot. Is this normal? It feels like a consistent flutter or movement over and over for 5 minutes or so. Yes, Chantel, and I think we actually just collectively refer to it often as hiccups. It might not actually be that the baby is physically hiccuping. It might just be periods of movement that feel very intense, but particularly that's very normal. Can I just say, and I always use this as an opportunity for educating all expecting mums, that if you feel like your movements not only less but also more intense, so any difference in your movements, it's just a really good idea to pay a bit of attention to that. And if you've got any concerns or you notice that they are very different, speaking to your midwife, because I feel like a bit of a myth that is shared for pregnant women is that you have to be worried when their movements are decreased, but actually a sudden increase in movements can also show us that bub is a little bit stressed. So if you ever have any concerns about that, and I say this all the time, maternity units are always staffed. Okay, so if it's 2 a.m, please don't go Dr. Googling and worrying yourself. Call your local maternity unit and have a chat to your local midwife, because they will be able to provide you with some guidance and reassurance. So please don't ever feel like you're stressed at home worrying about that. Hi Edwina, Bubby's 5 weeks old. Have a question about leaps. Hearing people. Oh, sorry, that's your question earlier that we asked, isn't it? Do you feel like I answered that for you? I've just put the link there for the sleep masterclass. A few of you are asking for that. We will be closing that shortly, so please make sure that you do register, only because we want it to be interactive, and we want you to be able to ask your questions. So we're going to do a live Q&A at the end of the sleep masterclass. So please make sure, if you do want to register, jump in and register now to save your seat, because we will be closing that shortly. Natalie has said, I'm having trouble with my 12-week-old bub Eliza. That's my sister's name. Natalie, what a beautiful name. Sleeping at night with her being grizzly, making noise, but her eyes are closed. Natalie, we will talk about that tonight. Very, very common. Alana, Perth, 9 weeks old. Georgie, Jill, hello from Wagon? I don't know if I'm saying that the right way. WA, 16-week-old little girl, Marina. Oh my gosh, how cute, Georgie. Hello from Casino, New South Wales, with 6-month-old baby Eleanor, and currently she is napping on me, which is absolutely fine, Natalie, unless you want her to be napping in her bassinet or cot, and that's another thing. It's like only a problem if it's a problem for you. There is no right or wrong. Danny said, morning Edwina, 40 this week, waiting on little girl to come. Lucy, hi Edwina, baby Matilda is 1 month old, can't wait to watch tonight. Oh my gosh, this is going to be so much fun. Armadale, 4-month-old, burping a lot after feed and very unsettled due to reflux. Only breastfed. Is it normal? Also had mucus in poo today. Mucus in poo is not Maida. I wouldn't consider that normal. So after when you're feeding your bub, can I just ask, is bub settled after the feed? Or you're saying very unsettled. Does she have a period of being settled? And also, is she gaining weight? I'd like to know, is she gaining weight and what the sleep looks like with that one, Maida? That's probably, so we do offer consults as well. That's probably like a bigger, there's a few things going on there, and definitely a few things that we would be able to address. Fritzy, hi Edwina, how are you doing from Canada? I present again, lol. Just talk to community nurse, and it happens that she told me that my bub is teething. I forgot to ask her what kind of gel that I can give to my bub. She's not sleeping good during nighttime. I feel bad for my bub. Fritzy, you can give paracetamol or ibuprofen. How old is your bubba? However, I would say, can you try a few things before that? And a few things might be freezing some frozen like fruits and things and putting them into a little net bag, depending on the age of your baby, or getting a little teething toy and freezing that and putting it in the freezer, because actually the cold has an anti-inflammatory, so helps decrease the swelling, which is often what is uncomfortable is in your look. It sort of looks red and hot and swollen as the tooth breaks through the gum. So anything you can do to help relieve that and offer comfort without having to give paracetamol and ibuprofen is kind of the first thing to try. And then there are different gels that you can get from chemists again, I would try just something frozen and cold first, because that works very, very well. 12-week-old little lady, New South Wales, looking forward to learning something to help with sleep. A few more Zs would be nice. Thank you. We can do that. All right. Anyone have any other questions? Michaela said, do the leaps also impact feeding? Currently dealing with a lot of fussiness with feeds, sleep pattern disrupted, etc. Absolutely they do, Michaela. So not only do we find that it decreases the length of sleep, decreases the quality of sleep, it also will result in a more fussy feeder and just a fussier baby in general. So I know that it sounds like this awful thing, but what I assure you is you just need to know how to get through those leaps. And that is something that we are very focused on in doing with our Birth Beat Sleep program. Yeah, Jenna's just surviving. 3 kids currently run on 3 to 4 hours sleep these days. Yikes, Jenna, let's help you out. Brianna, hi from the Gold Coast. My bubby's 5 months today. We increased her formula bottle size and dropped a feed as per the tin. Now she's refusing her bottle. She takes 100 mils and fights me when I try and feed her the next 100 mils. I was wondering if starting solids might help at all. Look, is your bub around starting solids? A good way to know about when to start solids is there's a few little tests. A, can your baby sit up independently in a high chair? So that's kind of the first thing. Can your bub actually sit in a high chair? You don't want to be introducing solids, with a baby sitting or lying down like that, or in a pram. You want them to be able to sit independently upright in a high chair. Does your baby show interest in food? Like, are they leaning in? If you put food on a spoon and put it to your baby's mouth, do they lean into that food, or are they watching you eat? They're usually some good indications that bub is ready to start some solids. It can also just be a little bit of a milk sort of, this happens as well with breastfeeding. It might just be a little bit of a stage and bub will pass through that stage. But just try those things and see if she is interested in some solids. Veronica, 13-week-old baby, dealing with really bad PPD, looking forward to the sleep masterclass. Oh, Veronica, I really feel for you, and I know that when we are feeling depressed and anxious, it is so much worse if we're not getting sleep. And I've been there. I have been there with Theo, and to the point where my anxiety was so intense after he was born that even when he did sleep, like I stressed and fretted about him going to sleep, that when he did sleep, I then found it really hard to sleep. So I definitely explore that as well in our program, and we offer a lot of support in our one-on-one consults, because I've been there, I've been in the trenches, and I know how hard it is, Veronica. So I'm so glad that you are going to be coming and getting the help that you deserve. That is what is absolutely important. Tez has said 7-week-old baby struggles with colic, waking up during naps and has a sore tummy. Any tips as not sleeping much? Yes, Tez, and a big part of that is often around burping. So making sure that we are effectively bringing up all the wind, and we teach you how to do that properly in our course. Hello, hello. Oh my gosh, I can't keep up with you all. You're all so amazing. Baby Amelia, 9-week-old, and Mama, love all your tips. Oh, thank you, Adriana. That's so lovely. Maida, yes, she's burping after each feed and is happy, but after a few minutes she wants to burp and cries and feels the reflux. Happens multiple times. Sometimes she's playing and suddenly she'll cry because of reflux, gaining normal weight. The situation is since 1 week. Maida, have you also had a diagnosis of reflux and able to speak to a midwife or a general practitioner about treating if it is that reflux? So what the reflux is that that's the burny, acidic feeling that the baby's feeling, and it can be very distressing. It's a burning feeling. So we can give you something to take the acidity out of the milk so that they don't have that burning feeling, and that will help. And the other thing is that's good to know is that she will grow out of it. Jody has said, back to work in May, bub will be 11 months. Do I try and introduce a bottle of formula through the day now that it isn't a fight for whoever looks after him when I go back to work? I'm worried this may cause him not to want to breastfeed anymore. Jody, look, you can introduce a bottle, but also at 11 months, just try introducing a sippy cup. So start just with water and see how they go with a sippy cup. And then you may be able to skip the bottle. And what helps then as well is that you can still be doing your breastfeeds in the morning, the night and the evening, if that's what you're planning on doing. So try with the sippy cup. I will say with the sippy cup mums, it's not instant. They don't just grab it and then start with the sippy cup. Let them play and explore and get used to that, please. Megan said, my bubby's showing all of those signs of being ready for solids, but he's only 4.5 months. Should I start with puree since he's quite young, or can I go straight to baby-led weaning? Megan, actually there's kind of two camps and there's lots of evidence to support both of those. And again, different countries have different recommendations when to start solids, but as a general rule, it is between 4 and 6 months, 4 obviously being on the earlier side. But if your bubby's showing that strong interest, there's no harm in trying. Just try it one meal. And again, it's not about whether puree or baby-led weaning is right or wrong. It's just having a try, maybe even having a combination, and just having a bit of fun with it. I feel like there's a lot of stress around solids and introducing solids. That's why we've actually made that part of our sleep program as well, is around nutrition and introducing food and solids, because that's so closely related to sleep. If they have a full belly, if they have all the calories that they need, they're more likely to sleep for longer. So we've included that in our program. Maida said, should I see a GP for mucus in the poo? Happened just once yesterday. Look, Maida, if it's just a one-off and you're not concerned and Bub's gaining weight, then I wouldn't be too worried. But just keep a close eye on the nappies is what my advice would be. Jody, awesome, thanks. He's handling the supply cup. Yeah, good. Sippy cup with water now, like a pro. Do I do the sippy cup with milk? Yes, you can. And Jody, if he's handling that like a pro, even just try a cup, and you might just skip the whole bottle stage, which is great because then you don't have to wean off the bottle as well. All right, team, I have put the last link there for the masterclass. Come and join us tonight at 8 o'clock. I cannot wait to share everything that we have got to sort of support you on this journey. And we have been answering all of your questions and helping put together a program that's going to help you around feed, sleep, age-appropriate guidelines. So when should your bubba be going to sleep? We are 100% got you covered from 0 to 2 years. So I can't wait to see you all tonight, and the program will be launching soon. I will do my best to answer some stories in Instagram today, but it is going to be a busy day. All right, talk to you all soon. Bye.